Welcome to this Oncology Data Advisor interview. Today we have the pleasure of talking with Dr. Amy O'Sullivan, who is the Senior Vice President and Chief Research Officer at Ontada. This week at the 2025 ISPOR Conference, the Professional Society for Health Economics and Outcomes Research, Dr. O'Sullivan is serving on an issues panel titled Are Social Determinants of Health Data Ready for Primetime? And today she's here to tell us more about this work. Dr. O'Sullivan, great to have you on the show today.
Hi, Kira. Thanks for having me.
Of course. To start off, would you like to introduce yourself and share what you do?
Yeah, sure. So as you said, my name's Amy O'Sullivan. I serve as Chief Research Officer at Ontada. Ontada is a McKesson business that leverages real-world data, real-world evidence, clinical education, and provider technology, all with the aim of improving patient outcomes in oncology.
Amazing. Looking forward to hearing some more about this work today. So,
Yeah.
quick background, would you like to tell us what exactly are social determinants of health and how do they influence health outcomes?
Yeah, thanks for the question. So, social determinants of health are those non-medical factors that can influence health outcomes. So, we think about things like socioeconomic status, education, income, access to food and transportation, those types of things that have been shown to influence health outcomes. We know that there is a body of research now today that shows that they do influence health outcomes in multiple ways. And I think that's primarily around pathways related to access to healthcare, availability of education on healthcare, and availability of services.
Great, thanks for explaining. And how do they create challenges for active participation in healthcare and clinical research?
Yeah, they create challenges I think, through a number of pathways. So if you think about individuals who don't have access to transportation, for example, and therefore cannot get to their physician in a timely fashion, that might delay diagnosis. It might delay the speed at which they can get access to treatment, and thereby also negatively impact health outcomes. And I think we can think of similar examples if you think about other social determinants of health, like access to food and income and the neighborhood that you live in.
Right. And how are social determinant of health data generally captured?
Yeah, so the capture of social determinants of health data are challenging. The best way to capture those data is through the individuals themselves, self-report. But as you can imagine, a lot of this information might be sensitive to individuals and they might not be as willing to provide it. These data can also be available in electronic medical records. If, for example, physicians are talking to their patients about some non-medical factors and the situations in which they live and work. They could capture those data in the medical record. And increasingly, this is happening, although historically we didn't have access to as much of these data.
Hmm. So I know there's currently a debate regarding whether social determinant of health data is fit for addressing health disparities and enhancing clinical trial diversity. What are some of the questions and unknowns around there?
Yeah, yeah. So my colleagues and I are presenting, as you said, an issues panel here at ISPOR. The question being, are social determinants of health data ready for prime time? And by that, we'll be debating whether or not the data are available and robust enough to understand the relationships between social determinants of health data and health outcomes. And then importantly, if they are robust enough to inform those questions, then also inform the action that we might take to address any disparities that we discover with the research.
I know you mentioned there's a growing body of evidence around social determinant of health measures. How has their collection improved in recent years and impacted diagnosis, treatment, and outcomes?
Yeah, yeah. Well, I think there's been an increased recognition of the impact of these measures to individuals' healthcare and healthcare outcomes. And so, because of that, there's been increased interest in gaining access to more data and therefore collecting the data. And so, increasingly, like you said, over the last several years, we've seen that the research has increased. And I think as the research increases, then there's also this impetus to collect more and more data to see how far we can go with it.
So, in the issues panel, what is the side you're presenting? How do you think these data should currently be used and how they'll continue to be used in the future?
Yeah, thanks. So in the issues panel, I'll be representing the side that says, yes, the data are ready for prime time. And the basis for my argument is a couple of case studies that we have conducted here at Ontada. So we've used our data, which is oncology data from community practices in the US. We've used it to assess the relationship between various social determinants of health measures, including race, a measure called Area Deprivation Index, the location of the practice, and other factors. And we've used those data to look at outcomes such as, are these patients getting tested for various biomarkers that are indicated for their cancer? Are they being diagnosed early? What is the stage at which they're being diagnosed? Is it early stage? Is it later stage? And do the social determinants of health that we're looking at affect time to metastasis or to death in these patients? So we have done, I'm presenting a couple case studies, but we've done a handful of other studies with pretty conclusive results. And so based on that, I do think that we have strong enough data to make some conclusions.
It's really amazing. So, what is some of the other work and research underway to enhance data collection and use it to inform efforts to address health disparities?
Yeah, so I'll give you one example from our business. So we have an EHR called iKnowMed. Again, it's used by over 2,000 oncologists throughout the U.S. Oncology network and the biggest community network of oncologists in the U.S. And there's something called the Distress Thermometer, which was developed by NCCN a number of years ago. And we have embedded the Distress Thermometer within the EHR so that physicians can ask patients questions about not only their physical health and their emotional health, but also social relationships and practical issues such as, do they have access to food? Do they have access to transportation? Are they worried about their medical insurance? Questions like that. So we have had that in the data for a couple of years, and have recently conducted some descriptive analyses and have been able to better understand the levels of distress that our patients have in the network.
Great to know. So, my last question for you today is we'll be posting this interview during Community Health Improvement Week in June. So, what take home messages would you like to share regarding how understanding social determinant of health data can help to improve health for our communities?
Yeah, I think the biggest take home for me, Kira, is if you have an interest in social determinants of health and how they affect health outcomes, if you're going to do some of this research, you should also really be thinking about how then you will leverage the results of your research for action. Because most of this research shows that there are disparities, that social determinants of health are creating health disparities in outcomes. And we want to be able to address those in the community and make sure that we are reducing those disparities as much as possible. So I think put as much effort into the research as you do the action after the fact.
Awesome. It's a great message to wrap up on. So, thank you so much, Dr. O'Sullivan, for coming on today to share your perspectives on this. Looking forward to hearing how the issues panel and the rest of the conference go. So, we really appreciate you coming on to give us a little preview today.
Yeah, thank you, Kira. Appreciate your interest.